Relax, so here I am. All right, here's my, come on in. This is my little slice of heaven. Every time I come home, I thank God for it.
How does it feel being here?
It feels good. It feels really good. You know, it's so funny, I was telling my sponsor, I was so excited to pay rent. Oh, I get all emotional, but yeah, because it's been so long since I've done that.
Danielle Gaddis says paying rent for her Portland apartment is a blessing.
My dad always tells me how proud he is of me, and I know my mom would be proud if she was here, so yeah.
Just a few years ago, she was addicted to heroin and living under a tarp on the streets. She's here now because every step of her recovery came with a roof over her head.
Love this guy.
Dr. Richard Bruno is a big reason why.
He's seen me, my transformation. You know, he's been here through this journey with me. And it's a good feeling. It's a good feeling to have somebody who doesn't judge.
I'm always telling you, I'm on your team.
He does.
You know, this is the thing. We're in this together. We're working on this together.
Gaddis' story is a bright light in a bleak landscape. And it's a long way from living in a tent in a city full of them. Along Portland's highways and streets, crushing poverty, addiction, illness, it's everywhere you look. It's obvious people living out here need care, and they need homes. Getting people off the streets and providing housing as the most basic form of healthcare is happening here in Portland. It's not solving the problem, but it is saving lives. This is Blackburn Center, one of the 30 buildings run by Central City Concern, a nonprofit agency determined to house the homeless.
Absolutely. We think that housing is healthcare and housing is life-saving.
Bruno is the senior medical director of primary care for the agency. The center here offers wraparound care and housing to the sick and the vulnerable who have nowhere to go.
I had a gentleman who I saw the other day who half of his foot was cut off after having frostbite, right? And he was discharged back to his tent where he was on crutches and having to sort of walk through the snow. And his wound opened up and dehisced, and unfortunately it started to get infected. So he came and saw us, and we said, "Where are you staying tonight?" And he said, "I'm going to go back to my tent." And I said, no, let's get you indoors, my friend. And we were able to get him into the recuperative care program.
The healing from illness or addiction begins here, and so does a health plan that always includes a place to live.
So this is a great example of a room here at our Blackburn Center. It can be sometimes a first stop for people on their road to recovery.
And they're getting care? Like, are there nurses attending to them?
Yes, we get a plan for the day, whether that includes going to a specialist visit or going to see one of the doctors downstairs, or any of our other services that exist across our agency. And we help them get a plan for transitional housing when they're ready and safe to discharge.
How are you doing?
I'm doing well.
Bruno's team helped Gaddis get into transitional housing when she was ready. She walked in off the streets to a clinic in another of the agency's buildings and was immediately offered a spot in an in-house detox program.
So where are we heading? Okay.
619, that's my room.
Yeah.
Apartment 619 became her safe place to keep recovering when she was drug-free.
But in order to stay here, you have to participate in EAC, which is the Employment Access Center, outpatient treatment. And usually it's only a 9-month program, but I was here for 17 months. Yeah, because I really didn't want to leave, actually, to be honest with you. It's kind of scary to, because it's been a while since I've been on my own.
She was scared, but she had support every step of the way.
And this is it right here. This is mine. Yeah, I used to have my name right there and all the little sayings right there, yeah. You know, I had a really, really good childhood. I had a 2-parent home. Parents were really involved in what we did. I was never abused. You know, none of that. I'm the only addict.
Gaddis says her addiction only deepened when her mother died.
I had never ever experienced homelessness, and it was really bad.
What was it like?
Depressing, really lonely, you know. I ended up in a tent like down the street from my childhood home. like literally, and I still don't understand what that's about. I don't know if I felt like that would make me feel closer to my mom, maybe, because I would walk by that house like every day. And so I want people to know that we're not bad people, we just made bad choices. And if you work hard enough, you can turn your life around and live the life that you deserve.
And how important was housing for that?
Oh God, really important. It would really help save my life.
I was in a housing program straight out of treatment.
Emily Fox says she wouldn't be here either if she didn't get the same help. She lived on the streets for 5 years.
How hard was it for you to be healthy when you didn't have a place to call home?
I couldn't have done it without the housing. Like without the housing in place, like it's impossible that I could have went to treatment for 4 months and had that amount of time and then went back outside to a tent and like sustained my sobriety or my recovery. It just doesn't work.
Hi, I'm just calling to remind you about your appointment with us on Monday.
Housing helped Fox rebuild her life. She works here now, offering the same compassion that saved her.
Every day I'm just like in awe that I work with like such absolute angels, because you know we see a lot of like hardship and a lot of struggle, and like everybody's always so kind.
When you see people coming in need, does it remind you of you?
Yeah, 100%.
And what do you see when you see those people?
Hope. I can be like, I was actually like literally just like that, and you know, with the right like support and the right like care, like you can come back from that.
Hey, I have a news crew from Canada here with me.
For Bruno, so much of his work is about restoring people's dignity in the face of so much inhumanity.
But I know they didn't get her into a wheelchair and see how she's going to get from her wheelchair down to her sleeping bag on the ground, which is what she's been doing every night, right? Like, there's no way she can do that anymore by herself. She's going to have a higher level of care. So we just see so many folks falling through the cracks every single day. And we see the repercussions of that throughout our city, and a lot of the stigma that happens when people are ignored or kicked out of other organizations or other businesses. And so it's amazing to see somebody's eyes light up when you say their name, call them by their first name, and talk to them as human beings.
That's a picture of me and my daughter.
That value on life helped transform Gaddis's life.
She had it custom made.
She has this place and a job. Her old life is still so close to home, but further than it's ever been.
And so I looked out and I just, I prayed up for the grace of God, there go I. But I know if I can do it, that anybody can do it.
So, Joanna, how much of a dent is this making?
It's making a difference and it's saving lives, but the agency we spoke to manages about 2,500 housing units, and the homeless population in Portland is about 6,000. But there are plans to invest more and to build more affordable housing stock. And it's really, the doctors there are practicing a vision. They truly believe that people can restore their lives with the right supports, and that housing is critical to that.
So people are always looking for good ideas to adapt here. So what specifically do you think Canada can pick up from this?
Well, they are already starting an initiative here in Toronto to build a 51 housing unit on hospital land. Again, a whole focus on health and housing. So there are lessons to be drawn for sure. And while that's still relatively new and in development, it's small, but the plan is and the hope is that it can be scaled more broadly. And we'll have that story in a couple of weeks.
Fantastic. Joanna, thank you.
Thank you.